This is preoperative anxiety in pediatrics. There's some risk factors for increased anxiety in kids. Being aged 1 to 5 is a higher risk versus being aged 6 plus. Having a history of poor medical encounters, parents with high anxiety, parental divorce, low parental education, and stranger anxiety develops around 6 to 12 months, so that typically is when it starts. There are some protective factors. Kids with calm temperaments, with daycare enrollment, and having more siblings tend to do better. There are some triggers for anxiety: parental separation, pain and discomfort fears, lack of control, uncertainty about sleep, masked ventilation is scary, and non-child friendly environments. So if you're in a normal hospital with no elephants or giraffes on the walls, that might be a little more triggering to children. There's some consequences of unmanaged anxiety. Unfortunately, these kids will have autonomic fluctuations more frequently. They'll also have higher anesthetic requirements and more post-op nausea vomiting. They can also have more pain, longer hospital stays, and this can end up costing more for the hospital and for the patient. There are some long-term negative responses. 50% will have long-term negative responses at 2 weeks, down to 20% at 6 months, and down to 7% at 1 year. These issues can be nightmares, separation anxiety, eating disorders, fear of physicians. So some management strategies would be to have an age-appropriate discussion of your anesthetic plan, both with the child and with the parents. You want to familiarize the child with brochures and tours and as much child-guided materials as you can. You want to have child-friendly induction rooms if possible, and if the parent is calm, you can have them around as well. You can also give anxiolytic medications, and the most stressful period is typically induction. So if you focus all these efforts around induction, usually the rest of the case does not pose an issue.